Well, we've many positive stories in our journey to improve smoking cessation programs in Vancouver Coastal Health. But one that sticks with me has to do with the smoking room in one of our acute care hospitals at Vancouver General Hospital on our tuberculosis ward. This ward is for patients who have more severe forms of tuberculosis, who are infectious to others. It has patients from around the province, many of whom come from vulnerable groups. The hospital had just finished renovating a smoking room for that ward when we announced that they had to get rid of all indoor smoking areas and we were going completely smoke-free. And we actually had some pushback from the respirologists and the nurses on that ward about this, who felt that it was only safe to provide a smoking room, that it was in keeping with our harm reduction approach. If we didn't do this, the TB patients would go outside the ward to smoke and they might expose others. We met with the group, met with the physicians, the nurses, talked about how we could support them in going completely smoke-free, and they ended up doing so and becoming very strong advocates for the smoke-free premises policy. So that to me was a great example of how we can change the mindset of people who should have been thinking about this all along, but we hadn't supported them in developing those policies. We've had similar great stories in some of our psychiatric wards, places where physicians and healthcare workers used to use cigarettes as a reward for patients who also did not believe they could go smoke-free because they had such high smoking rates among their patients, and they have been successful with the support from our team. Those types of stories are really inspirational to the rest of the health authority. If we can do it in those areas where we have high smoking rates, often very difficult patient populations, we should be able to do this with all our patients.